nice. Well, thank you everyone for joining A4LI for this month's policy discussion. I'm very excited for the conversation we have planned today, and I hope all of you are as well. For those of you who don't know me, I'm Brianna Deutsch, VP of Political Affairs in today's conversation. And today I'll run a discussion with Congressman Paul Tonko. Congressman Tonko is a Democrat who represents New York's 20th district. He was elected in 2009 and is currently in his 7th term in Congress. Representative Tonko sits on the House Energy and Commerce Committee, where he chairs the Subcommittee on Environment and Climate Change. He also serves on the Science, Space, and Technology Committee, as well as on the Natural Resources Committee. In this conversation, we'll discuss Congressman Tonko's thoughts on prioritizing the advancement of aging research and what can be done to create the necessary momentum in Congress to accelerate the development of longevity medicine. Congressman Tonko, thank you so much for joining us.
Oh, my pleasure, Brianna, and I appreciate the opportunity.
We're so happy to have you. Well, Congressman, I wanted to begin by asking you about how you first became interested in aging research and longevity medicine, and how do you think focusing on treating aging can help move us away from this sort of disease-centric approach to healthcare that is currently in place?
Sure. Well, thank you again, Brianna, and you and Dylan have been great to work with. And I'll share with you that I think age-related chronic diseases certainly are something that impact all congressional districts and states, regardless of where you are from or your political stripe. Every American has seen the devastating consequences of various conditions like these. And these diseases cause immense human and financial suffering for patients and their families, including the millions of family members who become full-time caregivers, and the situation will only become more severe if action is not taken. So in the case of Alzheimer's, for example, 5.8 million, and we do a lot of work with the Alzheimer's community, 5.8 million Americans are living and slowly succumbing to the disease. Without meaningful treatment, this number is expected to reach some 14 million by 2050. Now, tackling these diseases is a more effective and preventative way, and it's critical for the economic health of our country. In 2020 alone, Alzheimer's and other forms of dementia cost the country roughly $305 billion, with Medicare and Medicaid covering $206 billion of these costs. And with the expected increase in patients in years to come, total costs are predicted to spike to as much as 1.1 trillion by the year 2050. So the human and the economic costs of neurodegenerative and other diseases of aging are both unnecessary and certainly unsustainable. So I think there's also a growing understanding in Congress that the current approach is simply not working. So both sides of the aisle are beginning to recognize that in order to improve Americans' health and reduce costs in that long run scenario, our healthcare system should indeed focus more on preventing these diseases from ever developing in the first place. And I think that's the common sense approach that draws me to this discussion.
Thank you, Congressman. So for our second question, as you may know, some of the key priorities for the longevity community are, one, increasing funding to the Biology of Aging Department within the National Institute on Aging, and two, creating a regulatory pathway through the FDA for longevity drugs. So how do you think your healthcare agenda would fit into the longevity community's healthcare agenda?
Well, one of my top health care priorities is to make healthcare more affordable for Americans and to protect our government programs that so many seem to rely upon. So strengthening our investment in aging research will not only improve the health of Americans in the long term, but will result in the substantial reduction in healthcare costs as we bend that cost curve for patients and certainly for their families. My Democratic and Republican colleagues alike recognize the tremendous value of the National Institutes of Health, and that the dollars we put into research result in absolutely great returns on that investment. So the country continues to be a leader. Our country continues in that leadership role in biomedical research and drug development because of this long tradition of supporting our scientists and our research institutions. key to, I think, developing effective responses in government. Science-based needs to guide us. So as a member of the Energy and Commerce Committee, my colleagues and I have jurisdiction over both the National Institutes of Health and the Food and Drug Administration. This puts me in a unique position to lead on the longevity community's key priorities, and I'm looking forward to doing just that.
So although awareness about the potential of longevity drugs is growing, most members of Congress are largely unaware of their existence and thus do not understand the importance of advancing research into the biology of aging. What steps do you think need to be taken to work towards bridging this information gap?
Well, you're right about the information gap, and my colleagues and I on the Energy and Commerce Committee are constantly discussing policy issues and working on bipartisan initiatives behind the scenes. Thankfully, health and biomedical research are some of those areas where there's the most bipartisan work. This includes working together to combat age-related diseases. Just recently, I introduced bipartisan legislation to reauthorize the National Alzheimer's Project Act, or NAPA. And I can tell you that all of us on the Energy and Commerce Committee are laser focused on combating chronic diseases like Alzheimer's. I look forward to having conversations with my colleagues along those lines about the great potential of taking a geroscience approach to medicine. Once members understand the issue, I'm confident that this strategy will be well received. Because age-related diseases impact all of us in some way, I'm confident that there will be broad support amongst my colleagues.
So one of A4LI's near-term goals is to launch a longevity caucus in Congress. I'm curious to know your thoughts on what specifically you think a congressional caucus like this could accomplish.
Certainly. Well, I'm a member of some very significant caucuses on the Hill, and a congressional caucus can be a very useful tool to push policy initiatives forward. First and foremost, a caucus is a way to organize members and staff, I would include, that are interested in a specific policy area. A caucus can serve as a forum or a sounding board for members to bounce ideas around, and to do that during the policymaking process. And as members develop ideas for legislation, a caucus is an effective way to vet and fine-tune those ideas. I think the entire science of legislating is about consensus building, and having a forum, a stage by which to share information and your ideas and your solutions is what a caucus is about. It brings together people of like-mindedness that are looking to combat a certain problem, and enables them to bring all the forces of thinking that they have together in a common format. I'm a leader of several caucuses in the House, and I'm a member of many others. One of the most important functions of a caucus is to rally support for appropriations and liaising with the relevant federal agencies. So for the field of longevity science, those agencies would include the FDA, certainly, and the NIH, amongst others. But it really is a way to bring a single forceful voice that is comprised of many voices. We fill each other's voices in developing a caucus, and then create legitimacy by having the numbers in that are members of that caucus reflected in the work that we do. So, as I've seen some of my caucus activity grow specifically around certain issues, you then have a way of formulating more people to join that bandwagon of support.
So, thankfully, as a whole, funding for biomedical research has earned support from both Democrats and Republicans in Congress. And thus far, the longevity community's policy priorities have remained very bipartisan, so much so that they've attracted individuals as politically opposite as the former Speaker of the House, Newt Gingrich, and former Representative Steve Israel. So do you see longevity medicine as a bipartisan issue? And if so, do you think it can remain that way amidst sort of this politically contentious environment?
Well, it's an interesting question, and you're right about the acrimony. There's a lot of polarization right now on the Hill, and the events of January 6th did not help. Despite the contention between healthcare legislation regarding insurance, health in general tends to be, I'd say, a fairly politically neutral topic. So no one is able to escape aging and the chronic diseases that develop as a result. These are issues that impact everyone. There's a certain order of fairness there, and sometimes an unwelcome fairness. And there is broad support for advancement in this field. So the polls you conducted earlier this year demonstrate this, I believe. 73% of respondents believe human lifespan should continue to increase if advancements in medicine and technology allow it to do so. And a strong majority also approve of research into investigating the causes of cellular aging in order to better treat chronic diseases. So I think that speaks forcefully to the opportunity and the spirit that can unite us. As long as we keep conversations regarding longevity medicine and advanced medical research in general separate from the broader conversation on health insurance, I absolutely see no reason why this should not remain a politically neutral issue that both sides of the aisle can grow to work on in order of developing a consensus. So, it might serve as a bit of inspiration to know that we can accomplish in a bipartisan way and, inspire work on other topics.
Great, Congressman. This is the final question from me before we move on to a few questions from our
audience. They're good questions, I might add.
Oh, thank you so much. Well, we'll see how you feel about this last one. So the final question for me is about the political future that we see here in the coming years. So, economists are warning us that the US could potentially enter a recession sometime soon. We're also in the middle of midterm elections, and before long, we're going to be in the middle of the 2024 presidential campaign season. So with all of this noise surrounding Congress, how do you think this will impact our ability to make policy changes on Capitol Hill?
Well, you're right. There is a lot of noise on Capitol Hill these days. But my colleagues and I on the Energy and Commerce Committee continue to work together in a bipartisan way, regardless of who is in the White House or who controls the House. And I think that's a charge coming from the public. I mean, they expect us to remain responsible for advocating for resources and sound policy. And with regard to the economy, we in Congress can, I believe, walk and chew gum at the same time. We will continue to legislate regardless of the economic situation. It's also important, I might add, to remember that in order to keep this issue in the front of our discussions, to keep it front of mind for members, it's all of the competing policy interests. You must contact your representative and let my colleagues know this issue is indeed a top priority. I mean, and to accompany that with storytelling, share anecdotal evidence, talk about family members, friends, loved ones that are impacted by some of the issues that we're trying to address, and talk about the common sense approach of being empathetic, being driven with passion to respond to a cause and to save dollars in the long run and advance quality of life.
Yeah, and I just want to say, I do think there's this common misconception that there's no point in calling or writing your member of Congress because they're not listening to you, but it couldn't be further from the truth. I've worked in a handful of congressional offices and they certainly do listen. So please contact your member of Congress.
Well, I can tell you, Brianna, that we usually have stacks of piles of papers on our desk for various topics. And as they mount, you know what the priority is out there. So the voices are heard. I can tell you, even with the cynicism that wraps this system at times, I think it's important for us to keep in mind that the public opinion, the power of people in this process, it cannot be understated.
Could not agree more. So thank you so much, Congressman. Those are all the questions from me. And now we just have a few questions from the audience. So our first question is from Didier, and it's a two-part question. So the first part of the question is, what is the situation at the moment concerning the project of ARPA-H? How could this be accelerated? Do you think aging research has a place in ARPA-H? And I just want to give, before you go ahead and answer this, I want to give our audience a bit of background. ARPA-H stands for Advanced Research Projects Agency for Health. And the idea behind this organization is that it will fund sort of high risk fundamental research that perhaps the private sector would not have a commercial interest in because it's very fundamental early stage research.
Right. Let me just correct something I just said too about the anecdotal evidence and the importance to come to consensus for the economy's sake of it all and the quality of life. As I was saying it, I believe I said it cannot be understated, it cannot be overstated. So just letting us know that to the nth degree that this is a passionate issue with your supporters and that we need to prioritize highly. So back to your question. You talk about ARPA-H, and thanks for defining it for the audience, because there was so much success with the ARPA program with the Defense Department that it got itself woven into the energy responses and now into health. And so just last week, the House passed the ARPA-H Act, and this new agency within HHS, Health and Human Services, just like ARPA-E for the energy's sake, for Department of Energy, and DARPA-A at the Pentagon, it'll be one of those crown jewels of America's research enterprise. So it automatically gives it significance. I believe that the Senate will act swiftly to pass the ARPA-H legislation and send it to President Biden to sign into law this year. Aging research has a place, a definite place in ARPA-H. The stated mission of ARPA-H is, and I quote, to support transformative, high-risk, high-reward research to drive biomedical and health breakthroughs. So that's a tremendous mission statement. And aging research absolutely fits very nicely into this high-risk, high-reward research category. And it's a good thing generally when money goes toward biomedical research, whether it's public or private money. Yes, there are billionaire entrepreneurs who are investing in groundbreaking research in this field, but even more of a reason to increase government funding, though these therapeutics cannot be funded by billionaires for billionaires. They need to be funded by the people and for the people. And, I think a lot of the efforts with the public-private partnerships is for the public investment to absolutely shave some of the risk off of that private sector investment. So it engages and it inspires and encourages and challenges private sector investment by providing for a shot in the arm with the public sector investment.
So you already sort of touched on the second part of Didier's question, which was about sort of these longevity-focused organizations that are popping up in the private sector, that Google's Calico or Jeff Bezos is behind with Altos Labs. You sort of already sort of begun to answer that question. I don't know if there's anything else you want to add.
I think, I mentioned it because it's a common theme now. We're growing more and more into public-private matches for research. And I guess I jumped ahead of that question that she had simply by sharing my experience where the public-private thing has grown. We encourage it tremendously. And again, the risk shaving is very important to growing private investment. So it's a good partnership and it's becoming more and more commonplace. And it's actually recognized internationally. Many, many countries are into that public-private match.
Great. Well, our final question of the day is from Laura. So Laura asks, you've been an advocate for the Alzheimer's community for many years. What are some of the most effective ways you've been able to bridge together Democrats and Republicans in your work on Alzheimer's? And how can our community, the longevity community, learn from that advocacy?
Well, I think aging research and increasing the population's healthy lifespan are, again, an issue or issues that both sides of the aisle can agree upon. I think a recent A4LI poll showed that a majority of Democrats and Republicans support longevity science. Again, I think it's sharing your thoughts very, very aggressively, but tenderly at the same time with my colleagues, making certain that you share that anecdotal evidence. I mean, so many families have had this walk through life where it's very demanding, very emotional. And all legislators, I believe, want to improve their constituents' lives. And so funding drug and therapeutics development to treat aging as something that will help them live better, live longer, healthier lives. There's a motivation to support that agenda, but I would say by everyone in the House and in the Senate. So dialogue is important, making certain you share and develop a priority here for your representatives on the Hill in Washington, be they senators or congressional members. I think it's important for people to know that this has become a growing concern and that people want to see something done. And at the same time, it embraces our intellectual capacity. But as a nation, we have invested tremendously in science and scientists, in researchers. We ought to put that to work. You know, it's an infrastructure that needs to be called upon. And I think prioritizing this agenda is an important thing to do.
Well, that's all the time we have today. And Congressman, I want to thank you so much. I know you have a very busy schedule up there on Capitol Hill. So I just want to send you our deep appreciation and thank you to the members of our audience for joining us. We hope you enjoyed today's discussion and that you'll join us next month for next month's policy discussion. I hope everyone has a good morning, afternoon, evening from wherever they're joining us.
Well, Brianna, let me say it was a pleasure to dialogue with you. So, and good luck with everything.
Thank you so much. Thank you so much.